This video will be a quick wrap-up of cardiac mechanics by looking at the heart sounds and cardiac output. Depending on the author you look at, they may talk about 3 or 4 heart sounds. In this particular video, I'm going to focus on the 2 main heart sounds and then the third to a lesser degree before addressing cardiac output. So to begin with, there are 3 main heart sounds typically heard or potentially heard through a stethoscope with a healthy adult. Keep in mind I'm not discussing heart murmurs or incompetent valves here. And keep in mind also the third heart sound is not typically heard in healthy adults, sometimes heard in small infants, sometimes heard in the elderly. The heart wall is thin enough to get the echo, but the reality is we typically just hear the first 2. I'm going to talk about what all 3 of them are though. The first heart sound, the lower pitched lub sound, is associated with AV valve closure. Again, if you read the books, there's a lot of debate and discussion as to whether the sound is the valve closing, fluid vibrating, other things vibrating. Personally, I don't think the average clinician really cares too much about exactly what's producing the sound, so much as that the first heart sound is associated with AV valve closure. When you're hearing that sound, you're hearing it at about the time the AV valves close, and that's the big thing. This occurs during isovolumetric contraction at the very beginning of ventricular systole. The second heart sound is a higher pitched dup sound. This is going to be heard and associated with semilunar valve closure, and so this will be heard at the isovolumetric relaxation portion of ventricular diastole. So notice the first and the second heart sounds are heard, 1 at the beginning of systole and 2 at the beginning of diastole. The third heart sound is typically associated with the sound of turbulent blood flow during ventricular filling, especially passive ventricular filling. It's worth noting, since the ventricle's volume, actual physical space is increasing with relaxation and the blood's sort of rushing in to fill it, it does so in a turbulent fashion and can produce a swishing sound that can be heard in some cases. It does not reflect an abnormality of the heart. It's just turbulent movement of blood into the ventricle. Now, cardiac output is, in essence, the volume of blood moved per minute by the heart. It's volume of blood moved per minute. CO is calculated as heart rate, which is measured in beats per minute, times stroke volume, which is the volume of blood moved per beat or stroke of the heart. Stroke volume is going to be determined as the difference between end systolic and end diastolic volumes. So end diastolic volume is essentially the volume of blood at the maximum in the heart. End systolic is what's left after contraction, so the difference is what's moved per beat. That is your stroke volume. Just want to look at some sample numbers to give you a sense of how the heart can work really efficiently. We're going to work with some numbers that are fairly typical for a healthy adult male. These are just average numbers. These don't reflect any particular person. It's just a way of exploring cardiac output. So let's continue an adult male at rest who's got a stroke volume of 70 milliliters of blood per beat. That's 130 milliliter end diastolic volume minus a 60 milliliter end systolic volume. So 70 beats of blood, 70 milliliters of blood moved per beat. Typical resting heart rate for a male in their adulthood is around 72 beats per minute. That's a resting value. So if we calculate this out, that's 70 milliliters of blood per beat times 72 beats per minute. That works out to approximately 5 liters of blood per minute. And you may recall that the average adult male has around 5 liters of blood in their body. So in essence, what we're saying is even at rest, we're moving all of the blood in the body through the heart once a minute. That's not literally true, but it gives you a sense of the scale and the efficiency of the heart as it pumps blood. Just to give a counterpoint to that, let's talk about that same male during exertion. During exercise, you can see stroke volumes that approach 115 milliliters of blood per beat. And that's achieved really not so much by increasing increasing end diastolic volume. It's really increased by decreasing end systolic volume. The more forcefully the heart beats, the more forcefully the ventricles contract, the more blood they can potentially eject and therefore produce bigger stroke volumes. That same male during extreme exertion could have a heart rate that approaches 190 beats per minute. And so if we work with those numbers, we get a cardiac output that's 115 milliliters of blood per beat times 190 beats per minute, works out to approximately 22 liters of blood per minute. So notice that same male who moves approximately all of his blood through his heart once a minute at rest can exceed 4 times through, 4 trips through the heart for all of the blood volume every minute during exertion. It just gives you a sense of how effectively the heart moves blood and how efficiently it can increase output during exertion.